So this is again, I think, a very good straightforward question. Which of the following is seen in the angle closure glaucoma? Which triad, I think, because all the 4 triads they have given. Which of the following triads is found in the angle closure glaucoma? So this again I have taught you that it is the slit lamp where you are going to find the Vogt's triad. So in cases of the primary angle closure glaucoma, it is the Vogt's triad that you are getting. What is Vogt's triad? Vogt's triad mein we are getting number 1 is the glaucoma fleccens. Please check the language of the question. Please check the options and please let me know if there is any change required. Glaucoma fleccens. This is the anterior subcapsular cataract that we are getting. Number 2, we can get the patches of the iris atrophy. Patches of the iris atrophy that we are getting, right? Then number 3, we also get the pigments. Pigments on the corneal endothelium. So this is a very, very important thing. We always read that acute congestive glaucoma is an ophthalmic emergency and this patient is presenting with the acute red eye. This patient is presenting with the acute red eye. What is the characteristic triad that I am going to get? So, which triad is seen? Which of the following triad? Which of the following triad is seen in the patients of angle closure glaucoma? Options correct hai. Can you see? So this is a straightforward one. Acha, another important thing is that like they have asked you a straightforward question that which triad is found in angle closure glaucoma. This is also important a clinical scenario form. This is also important in the clinical scenario form of the acute red eye. So you have to be really careful for your NEET that it can present as a clinical scenario. So whenever you are getting a clinical scenario on acute red eye, when the patient is presenting with the sudden painful, when the patient is presenting with a sudden painful diminution of vision, or the patient is presenting with the acute red eye, what are the things you have to take into consideration? The first is your acute congestive glaucoma only. Then second can be your acute anterior uveitis. Then third, we can have the chemical burns. We can also have chemical burns. And we can also think about the acute bacterial keratitis. Acute bacterial keratitis. These are the common things you are going to have in the acute red eye. Now one thing is there which is not acute red eye but actually it resembles. That is your acute hemorrhagic conjunctivitis. Acute hemorrhagic conjunctivitis. So if you are having a patient of acute hemorrhagic conjunctivitis, then that can also present with the acute red eye with a sudden painful diminution of vision. Now, how will you differentiate? Because you know, most of the time these are the 2 DDs. So you should have a consideration how to differentiate between the two. So let's take both. On one side we have acute congestive glaucoma and another side पे acute anterior uveitis. So I will give you 5 very important points how you can actually differentiate whether it is glaucoma or whether it is uveitis. Number 1, if I talk about the gender, so glaucoma will be common in females while uveitis will be common in males. Second will be the age. Glaucoma will be more than 50 years while you talk of the uveitis, this is common in the young age. Okay? Then number 3, if you are having the glaucoma, you will have the stony hard eye. You will have the stony hard eye because you know IOP is very, very high. And you will have the very high intraocular pressure. While if I am having the uveitis, I will have the aqueous flare, that is the earliest sign. I will have the keratic precipitates. And the 5th important thing which they will definitely give you will be in the form of pupil. You will have glaucoma mein, you will have the mid-dilated pupil. Mid-dilated pupil, while in cases of the uveitis, we will have constricted pupil. Fixed in both. Pupil will be fixed in both. So these are the 5 important things that will help you in differentiating the acute anterior uveitis and the acute congestive glaucoma. Yes. So, are these options correct? Have you got the acute ophthalmic emergency? Treatment is not the problem. Once the diagnosis is clear, I think treatment is not a problem. Dono side pe you will have the circumcorneal congestion. Pupil is a great thing because you know pupil is entirely opposite. In cases of glaucoma, you will have mid-dilated, vertically oval, fixed pupil. In cases of uveitis, you will have constricted pupil. It will be irregular due to synecdoche, and obviously this will be also fixed. So this question is also fixed. Question number 2.